I really got first interested in this when I was about 15. I was working at a camp, a summer camp, which had a group of kids who had emotional difficulties. And the camp was run by a number of social workers, and they actually trained us a little bit about how to work with kids who had emotional difficulties. And I found myself really interested and fascinated by it. Then I went off to college and got interested in other things, and eventually worked my way back to the idea of going to medical school, probably with the idea of doing psychiatry. But once I got into medical school, I became fascinated with kind of general medicine and ended up actually doing a residency in internal medicine for 3 years and completing that before I went off to do my psychiatric training. And it really was when I had done that for a while and I was thinking about what do I want my subspecialty to be, that I found that I was interested in all the medical conditions that produced mental and psychiatric symptoms. So then I kind of thought, well, maybe I'll be a neurologist or a psychiatrist, but eventually I couldn't resist psychiatry anymore. It was a siren song, and I just finally gave in and have been happy ever since doing it. And you know, these are among the most common, prevalent disabling disorders of humankind. We're just beginning to really learn enough about the neurobiology and treatments to make a tremendous difference in people's lives. And they so much affect people in their medical care, in their family situations, in education, in a whole range of areas that I just found was the most absolutely fascinating and wonderful field. So that's what drew me in, and I've never regretted it. I think we need to find a language that can cut through a lot of the noise that's out there in the media. I think we need to find a common set of goals that are transparent, that are clear, and that are the kinds of things that are not only you can do something about, that are actionable, but if you talk to people in the general public, they'll understand, or policymakers, or employers, or others. So, for example, I think mental health, and when I say mental health, I mean substance use care, and also all of the elements of general medical care that are connected to mental health, which are very, very common. I think it's simply too large a problem for us to ignore as a country. The cost is too great, the cost in terms of medical care costs, in terms of educational costs, human suffering, the cost in the judicial system, people being in prisons instead of being in care. All of those things together are something that require us to come together beyond our own personal self-interest and do what's best for our patients and families. I think the second thing is to recognize that just as we come together as a community of mental health, that we need to help people outside come together as a community of mental health. You know, when we talk about the mentally ill as if it's somebody else, someplace else, with some other kind of condition, the reality is mental illness and mental disorders of various kinds affect 20%, 25% of the population. There isn't a day or a week that goes by that I don't get a call from somebody that I know in positions of various kinds who's looking for help for a daughter, a granddaughter, a son, a brother, a sister, a mother, an aunt, themselves. And many of those stories are very quiet. People don't know about them. We keep many of our successes secret, and sometimes our failures or the situations where people are not getting care become all too public. So we need to find a way to make this a much more embracing discussion. And if we can come together, maybe we can find a way to bring other people together as well. I think that number one is really to find a way to talk about this with the general public that cuts through the noise of the media. You know, there are all of these cases that come up, whether it's around gun violence or situations come up, you know, around other mental health or care issues, where we really need expert individuals, expert physicians, expert other caregivers to be speaking on behalf of patients and their families. So we need to find a way, number one, to cut through about that. Number two, I think we need to help people understand the size and the scope of the burden of this illness. We've got returning veterans. We've got the medical care costs. I was just talking with Tom McClellan this morning, who was the Deputy Director of the Office of National Drug Policy. He's a leading substance abuse researcher. He said in 2009, the Congressional Budget Office, CBO, said that the medical care costs associated with substance use illness are another $120 billion a year. we have evidence from a number of studies that the total costs of medical surgical care associated with people who have mental health substance use illness, not because they're bad people, but because they're not getting the total care that they need, and that care isn't integrated with their medical care, maybe as much as $250 billion a year more than it would be if they didn't have those disorders. 14% of individuals who use mental health substance use services, their total medical surgical care costs are about 30% of total medical surgical spending. So if we're going to ever get our hands around the cost of health care, the burden of these illnesses, we're going to have to do that by looking at these things very holistically. So I think that's really number one on the agenda. Number two is we have to really make sure that parity and the Affordable Care Act, all of the legislation that is being put together and is now in place, that there's appropriate transparency, disclosure, and enforcement of those rules so that the patients who are sitting in emergency rooms waiting for beds don't have to wait in the way that they have. And tied to that is the reimbursement has to be fair. So if hospitals are losing money because they're taking care of patients with psychiatric illness and they close down services, having all the rules in place to protect people won't matter if there isn't access to care. So we have to find a way to make that conversation something that is meaningful to people, and that it's about something that's really going to benefit us total as a country. You know, mental health and substance use issues start, by and large, in childhood and adolescence and early adulthood. If you ask any parent, any mother, father, in most communities in this country, what are they worried about? They're worried about their kids using substances. They're worried about their kids getting depressed. The town I live in, we just had 2 teenage girls, high school students, commit suicide in the last 2 weeks. These are the things, if you look at the disability, the biggest causes of disability in this country for folks between the ages of 20 and 50 is mental health and substance use illness. So we need to find a way of getting those concerns out there because, frankly, they're things that worry everybody.